We got some other concerns with the bill. The bill looks like it would take out about 2,700 seniors who have signed up for the Medicare Advantage plan. A much larger number. It's over about 160,000 seniors in Medicare Advantage that would be canceled by this legislation. And according to the American Hospital Association, the bill would make almost $300 million in cuts to 10th District hospitals. Overall, it's about $6 billion in cuts to 133 Illinois hospitals. Also worried about its effect on employer-provided coverage, and you can see here, roughly 170 million Americans get their health insurance through an employer-provided plan. By one estimate, this bill would trigger at least 15 million Americans losing their coverage. That's the Congressional Budget Office estimate. The Llewellyn Group estimates a much larger number, about 88 million would lose their coverage. The next chart shows some concerns that I have with the taxes. You know about the payroll tax that would be put on this, and a new surtax that would raise the top marginal rate in the state of Illinois considerably. If we go to the next one, you can see that the impact on Illinois, raising the top rate to 49.97%. And we would see about 41,700 small businesses in the state of Illinois that would be required to pay this extra tax.
I gotta take the elevator.
If you compare the taxes that are included in the bill, this shows that if you look down to Illinois, which is number 40, you see that our top marginal rate, if H.R. 3200 was passed, would be 49.97%. If you look, that means that we would be even higher than the top marginal rate of France, which is 45.8%. Ironically, we would not be the worst hit state. Oregon, Hawaii, New Jersey, New York, and California would have tax rates higher than Sweden, which is the most taxed country in Europe. And I worry, in the face of the toughest recession in our living memory, if that's the right way to go. Another thing I'm worried about is health savings accounts. We have almost 500,000 individuals in Illinois with a health savings account, but it's not rated under H.R. 3200 as acceptable coverage. And I think that's, we ought to go in the opposite direction. We ought to have more and more Americans with health savings accounts. Bottom line, in the careful work that I've done over many months, if you look at the next chart, we have roughly 50 laboratories that have been covering millions of Americans for dozens of years. And we can see the state that's the worst in the union and the state that is the best. The smoking hole of health insurance in the United States of America is the state of New Jersey. They have pushed up their insurance costs to $5,300 per patient. No wonder you would have uninsured. With that level of litigation and administration, they are pricing their own citizens out of the health insurance market. Ironically, despite its reputation, the state of California is the best in the nation, with what I regard as rock and roll and lawsuit reform. Large, flexible insurance pools. So they've cut their costs to less than half of what New Jersey is. Making sure that we make the kind of reforms like these will lower the cost of health insurance for Americans and dramatically improve the economy without draining the United States Treasury or authorizing one of the largest tax increases in the history of the United States. So that's my quick presentation. I'd like, if you could all welcome Dr. Fessler, one of the key leaders of my healthcare task force that helped me put together this legislation, for a brief presentation, and then we are open for business and questions. Dr. Richard Fessler.
Good afternoon, everyone. I really have very little to say. I'll be available to answer any questions. As a practicing physician, I've had the opportunity not only to practice in the United States, but to practice in many of the other countries that we're looking at now to modify our healthcare system. I've also studied all of the experiments we've tried in the United States, Maine Care and TennCare and the Oregon system, and how they fared with a very similar system of medical care to what's being proposed by President Obama. And I'd be happy to answer any detailed questions you have later, but the bottom line is, in every single case, they have failed miserably. And to institute this on a national level, as a physician who wants to care for patients, it's horrifying to me. Thank you.
Now, right on time, as if he was heading for the emergency room, the chair of my medical advisory committee, Dr. Jay. No, you don't.
Hello. As we enter this whole issue of health reform, and we're way in the midst of what's hopefully will be some reform to our health delivery system, because I think every physician will tell you that we need health reform, and we need health reform now. We need good health reform, and we need the right health reform. Physicians look at our healthcare system somewhat differently, I'm sure, than many of you, but not that much differently, because we are parents, we're husbands or wives, we are small business owners. We deal with the same issues in part that you do, and we see our patients suffering because of rising healthcare costs, because of the inability to be insured or the inability to buy insurance because of restrictions to insurance, the numerous bureaucratic red tape there is and the denials in healthcare. And we see all that also, and we're concerned. We also see the issues in our seniors and the problems that exist now in Medicare, and the issue where soon we'll have all of our seniors with insurance but no access to primary care physicians because there won't be any. We have a workforce problem in healthcare. We have a disproportionate use of resources in healthcare. We have a finance system in healthcare that just frankly doesn't work for most everyone to some extent, including the physicians and the providers. We have some of the best minds in healthcare in the world. We have good quality healthcare in many different ways, and in some ways a failing system. We have a government-run healthcare system in Medicare that, as a senior, is a godsend, but in many ways we see the writing on the wall. We see the reductions in reimbursement. We see the physicians walking away from Medicare. We see the inability of seniors to access the kind of care that they need. We have a system that was based in 1965 with 9 million Medicare recipients, with an average life expectancy of 4 years and 11 taxpayers for every one Medicare recipient. And in 2009, we have 45 million Medicare recipients, 3 taxpayers for every one Medicare recipient, and thanks to the quality of care that we have, almost a 20-year life expectancy from entering Medicare. That is good news and bad news. The bad news of it, of course, is that how are we going to be able to afford Medicare as we go forward? So we have problems not only in those that are uninsured, and Lord only knows that that's a problem, but we have problems in those that are in fact insured. The good news is that we're having these town hall meetings and we're discussing healthcare and trying to find ways of improving our delivery and our financing of healthcare. And the bad news, unfortunately, is that some of the times we get sound bites that are that misrepresent the issues, and sometimes are disingenuous on both sides. And what we need to do is to be able to sort out what's important, to find the solutions that we need to take our healthcare system to the level that we have. You've heard many quotes about the quality of care that we have and where we rank in life expectancy and infant mortality, but we're all smarter than that, and we understand that there's reasons that have nothing to do with health care when one looks at things like life expectancy and infant mortality. We have the largest population of teen pregnancies in the world. We have guns, and we have violence, and we have drugs, and we have deaths of young people, and when you add young people dying into a life expectancy, it certainly brings down your average. If you take those things away, we have the best life expectancy. Once you get past those sociologic issues, when we deal straightly with healthcare, we have a quality of healthcare that is excellent but disproportionate and is inaccessible to many, and we need to fix that. The president was correct. We need to do something now, and the worst thing that will happen is if we do nothing at all. Thank you.